Hello, Amber here from LoveFit and She, and today we are talking about the pregnant core in week 29 of my Healthy Happy Pregnancy video series. So, bit of a kind of sciencey lesson today, a little bit technical, but I think this is so important for people to understand, especially during the pregnancy, because if you can get your head around this now, it's going to stand you in much better stead in the postpartum period when you're trying to heal. If you wait until after you've had the baby to try and really get the core, you're going to be sleep deprived and very busy with the baby, and that's probably not the time to be trying to assimilate this. So I'm going to make this as basic and easy to follow as possible, but I really think it's crucial for you to understand what we mean by the core, what changes happen, and what we need to do to maximise how your core functions during your pregnancy. Just because this is really going to help keep you in the best possible shape during your pregnancy. It's going to help massively with the birth, and as I said, it will help in the postpartum period as well. You'll get a real head start on that. Okay, so firstly, when we talk about the core, I think often people think of the core as just being the stomach. When I get clients saying, can we do core work? Or people saying, oh yeah, I need to strengthen my core. They don't necessarily appreciate how much it encompasses. So the first thing I'm really trying to drill down here is what the core actually is and how much the core comprises. So you've got, with your core, you have got the abdominal wall. So this is, the front of the body. I don't need to go into great detail about what muscles exactly, but there's lots of different muscles that make up the abdominal wall. With the pregnant core, we're talking about everything that goes on there. So you've got a deeper muscle, the transverse abdominis, but also the rectus abdominis, which is the theoretical six-pack. That's the one that can often separate in pregnancy. So we're talking about all of those tummy muscles. Then at the bottom of the core, we've got your pelvic floor. So we all know about the pelvic floor. We don't necessarily always think about it in terms of its relation to the core, but your pelvic floor is directly linked with the transverse abdominis here in the abdominal wall. So everything is connected, and what I'm trying to get across is that this functions as one big unit. It's not lots of individual things, okay? Then at the back, we have got not just the lumbar muscles, which sometimes people do understand with core work. If they've got back issues, they'll have been told by a physio or whoever that they're seeing, or whatever therapist, they'll have been told that they need to strengthen their back to improve their core. But as well as the lumbar muscles, you've got your thoracic muscles, so all of the muscles in the upper back as well, and actually the glutes. People forget the glutes, and I really do like to think of them being an integral part of the core, because where your glutes attach into your pelvis, because they are a stabilising muscle for the pelvis, they are then part of the core. They do form part of this whole core function. And then at the top of your core, we have the diaphragm, which is your breathing muscle. Okay, so breath is a crucial part, and in fact what I'm trying to get across in this video today is that your breath really drives the function of the core and really drives how you can actually make all of this link up and work well to help you with your pregnancy and your labour. Okay, so then, considering the pregnant core, let's have a think about what changes actually happen. So firstly, obviously, the abdominal wall is massively stretched. So, if this is your theoretical body pre-pregnancy, post-pregnancy and during, that's all going to be stretched out in this direction. So the abdominal wall is massively put on stretch to allow the baby to grow. Then down at the bottom, your pelvic floor, clearly again, lots of pressure downwards, because the baby's head, especially in the later stage of your pregnancy, the baby's head is pushing down on the pelvic floor. So you're having to support a lot of extra weight through the pelvic floor. Then at the back of the body, we tend to get a lot of postural changes in most pregnant women. You can get what we call a kyphotic curve, which is the upper back. So when I spoke in very early video about upper cross syndrome, we're talking about these upper back muscles getting very curved, but also a lordotic curve, which is the lower back being very arched, so if people's pelvis tilts very forward into an anterior position, then you can get this lumbar lordosis, both of which are obviously changing your posture, and it is a dysfunction. It means your body's not as well able to support you and stabilise your spine. And then At the top of the core, the diaphragm changes during pregnancy are mainly that your diaphragm gets hugely displaced because, again, the growing baby and all the organs being pushed up, your diaphragm gets pushed up as well, meaning that often shortness of breath is quite common, especially in the later stages of your pregnancy. So lots of changes going on. So, you know, a lot of people kind of vaguely know some of this stuff and just think, well, yeah, that's part of what happens during pregnancy, have to lump it really. But actually there's a lot you can do in order to try and minimize your pain, maximize your body's function and keep yourself strong and pain-free, and hopefully have as good a labour as possible and as quick a postpartum recovery as possible. So, going back to our abdominal wall, what do we actually need to consider during pregnancy? Well, we need to make sure your abdominal wall is strong. So I touched on this a few videos ago. There's one about how to properly work your abs during pregnancy. And what we're looking at here is remembering that traditional ab exercises like sit-ups, like crunches, increase the pressure within your core. So they push out on the abdominal wall, they push down on your pelvic floor. That's not a good thing because you've already got all those extra forces because of the pregnancy. What we want to do is use exercises that actually decrease the pressure and bring everything in naturally, so that you're not placing extra pressure on these already stretched muscles. So strengthening the abdominal wall with the correct type of abdominal exercise is crucial. And I've done some of these already and there will be more in future videos, but I'm hoping that by doing this video you'll understand why I'm encouraging you to exhale on exertion, why I'm telling you to think about using your pelvic floor at certain points during an exercise. Hopefully this will help it make sense. The pelvic floor, obviously, again, we need to keep strong, not least because of the growing weight of the baby, but during the labour itself, people often don't realise that the pelvic floor actually acts to turn the baby. So as your baby's head pushes down on the pelvic floor, if there's some good resistance there, it actually helps to turn, and it acts as a spring to help turn the baby into the correct position. And if you've got a very lax pelvic floor without much strength and resistance, it can take a lot longer for the baby to get into the right position, or it can mean complications or a very, very drawn out labour. So a strong pelvic floor is crucial, but this is where I want to also mention that ultimately during the birth itself, your pelvic floor is going to have to relax too. You need some relaxation. So it's actually all about balance. And in week 30, in the next video, I'm going to talk about this much more. So I really wanted to include that as part of what I'm saying today, so you understand that yes, we need a strong pelvic floor, but it also has to know how to function properly, which is strength and balance in equal measure. With the back muscles, again, it comes down to having strong supported back muscles. So during pregnancy, we want to make sure we are working the posterior chain, all of these upper, lower back muscles, as well as your glutes. That's why from the get-go I've been saying in these videos that keeping your glutes strong is really important. That's going to minimize your pain massively. If we can keep your back supported, keep your pelvis stable, nice strong glutes, nice strong back, it's going to stop so much of this center of gravity shifting and keep you in a really good posture, which ultimately will keep you in far less pain. And then with the breath, obviously what's really important is to realize how to breathe properly, not least because your breath will really help during your labor. If you think about it, most kind of yoga and meditation practices that are supposed to relax you focus on the breathing. And you'll be aware of that more and more when it comes to labour, that actually breathing properly helps to stimulate the parasympathetic nervous system, helps you to relax and release all the correct hormones to try and get your body to birth as naturally as possible. If you've got very shallow breathing and dysfunctional breathing, it's not going to help with the birthing process. And actually, also I've mentioned in my pelvic floor videos, and I will be mentioning this again, is that most people do have a kind of a dysfunction with their breathing. If you think about how often people jokingly say, when referring to getting into, say, a tight pair of trousers, or if they want to squeeze past somebody, they'll say, breathe in, as if that makes you smaller. But actually, when you breathe in, you should expand. The air should be pushing out on the ab wall, the diaphragm comes down, everything expands out. It's when you exhale on the out breath that you actually get this compression of the whole core. So as you exhale, the diaphragm lifts up, so too does the pelvic floor then contract automatically. The abdominal wall actually comes in. You can feel that when you do a really slow, purposeful exhale. You'll feel your abdominal wall contract. And all of these back muscles automatically fire up and are switched on. Okay, so that's actually what happens when you exhale. So the importance during pregnancy is to appreciate how the breath works and to get a handle on how your breathing is linked to all of the stuff going on in your core, which is why when I'm saying during, say, a standing press up, exhale as you push back and exhale on exertion, is because as you exhale, all of this naturally contracts. So we maximize that to think about lifting our pelvic floor and to really get all of this working as one really functional unit. Okay, so what I want you to do is rewatch this video if you need to, but I really hope that helps you to understand what happens in the core, what changes occur during pregnancy and what we need to do. And then the fact that getting all of that into your head now and understanding that while you're exercising during this last trimester will also really prepare you for birth and that postpartum period. If you've got your head around this already, then post-baby, when you're looking at trying to regain good function, you're going to find it much, much easier. Okay, I really hope that was helpful. Drop me a line if you have any questions, and I will see you soon in week 30 to talk more about how to release the pelvic floor. Okay, thank you very much. Bye-bye.